Today is World Autism Day, and last week the Ontario government announced a $120 million in funding for autism services as part of its 2024 budget.
But advocates say this boost of money is far from enough to address the tens of thousands of children waiting for provincially funded autism services. So joining us now to discuss her ideas to advocate for timely support and funding for those families living with autism spectrum disorder is Dr. Robin Baweja. Dr. Baweja, thanks again for being here this morning. Good to see you. Yes. I know this is something you deal with in your practice here.
I do.
You work with a lot of people on the spectrum here. So $120 million, it sounds like a lot of money, but far from being enough. So what do we need to see here when it comes to autism in Ontario?
So autism is such a dynamic mental health condition. And when that's said, a lot of the therapy that goes involved is very costly for parents. So we're talking about in Ontario that we have two types of funding. One is privately funded and one is from the government. And at this time, the level of funding that's available to families is just so scarce. I mean, we're talking about wait lists up to 2 years. And we're thinking like 5 to 10 years ago when I first started, a lot of parents were able to secure funding within 12 months. And now it's more than 2 years. And so we're talking about 2-year wait time for therapy that's really fundamental for these kids to progress and just, just rehabilitate.
Right, absolutely. And when you're dealing with young kids, in that 5 years old age category, even younger, timing is so important because that's the years when they're developing, the neurons are, connecting in the brain. So this is quite detrimental if there's such a wait list to get to behavioral therapists or speech therapy. What do you see happening here if that doesn't get addressed?
So the government has done a really good job with securing funding to allow physicians like myself to actually diagnose a child. So we can diagnose as early as 2 years to 3 years of age, which is it's a really good time to diagnose a child. But then we're talking about then securing funding. And so then we're asking parents to register through the OAP, and it takes about 2 years. So there's a core part of their development between 3 and 5, which these kids are just not getting any therapy unless they're able to support it outside of in their own pocket.
And this is expensive therapy. I've done a lot of stories about it. We're talking like tens of thousands of dollars a year, aren't we?
And we're talking about 16 to 20 hours of therapy a week, which can be costly. And we're talking about different forms of therapy, such as speech therapy, occupational, physical therapy, and ABA therapy.
And what do you think is the problem with getting this funding out? I mean, we had the pandemic and CERB was rolled out almost overnight.
Right.
So when it comes to kids and or families that need this service and the money to support it, why do you think it's taken so long? You kind of have this, you have 3 main ideas that I think could be really helpful.
Well, I think there was a disconnect in regards to allowing physicians to first be educated enough to diagnose. And then we have this influx of kids that are being diagnosed with autism at the age of 3, but it's such a high population, and now we're talking about kids that just cannot. There's just such a we just have like at least 50,000 people on the wait list that just are not able to get. So I think there's just a disconnect, and they didn't anticipate how many kids were going to require the funding. And I think we need to start both at the federal level, the provincial level, and also a grassroots level, because I think a lot of families just are not able to navigate the challenges that come alongside the diagnosis.
It really surprises me, Doctor, and I don't know if you want to get into policy very much at all, but whether it's a federal government, provincial government, but I mean, doctors, experts have been advocating for this for years. I mean, I've been doing this job about 25 years now. The number of stories I've done about insufficient funding, wait lists, et cetera, whatever level of government, it seems like governments either aren't listening or aren't seeing the reality on the ground. How do you see it from your perspective?
I have a really unique perspective. I get to see parents, I get to see social workers, caseworkers, educators, teachers, CERTs coming into my practice. And I think what we really need to do is have an inclusive community. And that includes government officials as well. We need to have roundtable discussions that are not solo. We don't just need to have governments making their own decisions, educators making their own decisions, parents making their own decisions. We need to sit down and really come up with an inclusive society so that we all navigate how to better assist these families.
And Dr. Baweja, right now, if you do see a family, they come in, with their child, a young child, they're like, we can't get the funding, we don't have the money or access to these services. What is your advice, to families with children who are on the spectrum that need help right now? What do you advise them to do on their own?
So as a practitioner, I try to see my patients as much as I can, because I think I end up being one of the most solo people that parents can come in and seek their help from. I try to seek out therapists as well that can offer a little bit better of a financial assistance to these parents, and some grassroots organizations that are popping up all the time. But I'm trying to just keep well updated into my community so that I can offer a little bit better extra support for my families.
Okay, really important conversation on this World Autism Day. Dr. Baweja, thanks for joining us again this morning. Appreciate your insight into this.
Thank you.
Thank you so much.
All right,
Thank you
good to
so
see you
much.
again.
All right,
Thanks
thank
very
you.
much. Yeah.